Welcome to Medicine, Motherhood, and Missions, the podcast where we dive deep into impactful and inspiring conversations with amazing professionals who've turned their challenges into stepping stones for success. I'm Johanna, your host, and each time we meet, we'll explore the stories and journeys of remarkable individuals who are PAs, doctors, professionals, mothers, and mission-driven changemakers, from the halls of the hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between and see life through each other's perspective. If you're seeking fulfillment in your career and life, I've got something special for you too. Download our free guide on how to be a fulfilled provider. It's packed with tips and insights to help you thrive while balancing the many hats you wear. And for all those parents out there dreaming big while raising little ones, check out Little Evie's Big Dreams children's book series, available now on Amazon. These heartwarming stories inspire kids to chase their own dreams, just like you're chasing yours. So grab your favorite cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Hi, friends. I'm so excited to have with us today Dr. Sarah Mills, and I'm really excited for you guys to hear this episode and listen in to the pearls that she has and her heart for medicine. She's an internal medicine physician practicing as a hospitalist for a very busy teaching hospital. She also practices as a locums provider and that allows her to enjoy her love for travel. So thank you so much, Sarah, for joining us today. Thank you for taking the time out of your very busy schedule. And just also, incidentally, we met because you were taking care of my husband in the hospital one day. And so I just, went up to you and was like, hey, do you want to be on my podcast? And you said, yes, sure. So I really appreciated that.
Yes, of course. Well, thank you so much for having me here. I'm really excited to get to do this. As a result of our meeting, I definitely, listened to your podcast and your message, your mission. It's a lot of the same passions that I share as well. So, and of course, it was good getting to take care of your husband, and I'm glad to hear that he's doing better now.
Yeah.
So, really happy to be here, and just excited about the podcast.
Yeah, we really appreciate your care and compassion. And so tell us a little bit about yourself and what you do for fun.
Yeah, so I am born and raised in a small town in Kentucky and basically spent my whole life with aspirations to become a doctor. And so, with a few little side steps along the way, I had some, aspirations at one point to be a forensic pathologist and had a few different things like that I had interest in, but they always were in the science realm. And so ultimately, I did decide that medicine was my passion. And it was a little bit interesting. I didn't have anyone in medicine specifically in my family. So I was really the first one to go into medicine. But I always just enjoyed the idea of helping people. I enjoyed science. I enjoyed learning about the world, learning about new things, learning about people. And medicine really seemed to be the perfect kind of culmination of all of those interests. So medicine is definitely a passion of mine, of course. And then outside of medicine, as far as hobbies and things that I like to do, I enjoy traveling. My husband and I both enjoy traveling as much as we can. And so we like to visit new places, explore new cultures, new food. I enjoy music a lot. And so I play piano. And just recently, I'm trying to pick up some other new hobbies as well, trying to find things like painting and other things to dedicate some time to when I'm not working in medicine specifically.
Yeah. Oh, that's so cool that you paint and you're creative at heart.
Yes, I wouldn't say I'm all that good at it, but it's a skill I'm working on. So
Right. Yeah. Yeah. I think painting anyways is a skill that you have to keep working on sometimes.
yes, definitely.
Well, that's neat. And so how did you specifically choose internal medicine as a specialty?
Yeah, so that's a great question. I always, when I thought about being a doctor growing up, I really only had this kind of limited view of what a physician was in really an
Hmm.
outpatient setting, because that was my own experience as a patient. As a
Hmm.
child, you would go to the doctor's office. And, fortunately enough for me, in my childhood and adolescence, I didn't really have any sick family members that I was really ever seeing a
Hmm.
hospital setting. And so,
Hmm.
the hospital setting as a whole was something entirely new to me, and other than just exposure from TV shows and things like that,
Right.
I never really considered it as part of what my specific career goal was. And I
Hmm.
worked as a medical assistant when I was in college, and that was at a primary care clinic. And I
Okay.
really enjoyed that a lot. And so I thought, well, this may be a good fit. But then
Hmm.
ultimately, as I was in medical school and started rotations, I had an experience in an internal medicine program where I ultimately matched into residency. And the
Hmm.
residents there, they loved their job. They loved what they did, as much as you can love residency with all the stress that brings.
Yeah.
Um, but they really kind of opened my eyes to a different side of medicine. And one of the specific things that I love so much about it when I was looking into different specialties is that
Hmm.
it felt like some sort of almost instant gratification, in a
Hmm.
sense that you can see someone who's quite ill, very sick.
Hmm.
You're able to get objective data back so
Hmm.
quickly.
Yeah.
Whereas, in the outpatient world, things are often delayed. Your answers might not come for weeks or months when you schedule images and tests.
Hmm.
But in the hospital, I could get that information back and have a grasp on exactly what to do with that. And
Hmm.
then the goal is to see people get better, to see people leave the hospital.
Yeah.
And the flip side of that, of course, is that unfortunately the nature of the job is that sometimes people don't get better, and ultimately they die in the hospital.
Hmm.
And that comes with its own sense of challenge as well. And of course, it's a major adjustment that I had to get used to in this field
Yeah.
specifically. But it is, it connects you, I think, to humanity when you're around
Hmm.
people who are dying, and it gives you a
Hmm.
different perspective on life itself, I think.
Yeah, for sure. And yeah, I think, I think I told you I had worked in hospital medicine from when I graduated as a PA. I got to work with the hospital medicine team. So I definitely get where you're coming from with how you love that tangible look and seeing how the patients improve while in hospital. Yet, of course, the the acuity, the severity of disease that leads to sometimes untimely deaths can definitely occur, and that makes it really hard in these acute settings. Um, how do you deal with that? Like, how do you, as a physician, as a person, like, how do you heal yourself or like come out of those situations? Like, after facing death, bereaving with those families and seeing the, loss and grief from, the
You know,
families.
Yeah, it's a big challenge, and it's something that I
Mhm.
would say I've really had to learn how to deal with over time, because it's
Mhm.
you you don't really, that stuff doesn't really come naturally to
Mhm.
people. I'm quite an, I think, emotional person. I feel like I'm very in tune with emotions in general, and
Mhm.
I feel like it hit me very hard in the beginning. The first time that you see someone die and you're in
Mhm.
training, it's like it almost just kind of like takes your breath away, the
Yeah.
feeling and the wave of
Mhm.
emotions that you feel. And then you also have to juggle that with the respect that is due to the family members, to the patient who just died,
Yeah.
and how to process your own emotions
Mhm.
without really imposing those on someone else's space in a way that could make them feel worse, or it's
Mhm.
challenging. So
Yeah.
I would say it's taken some time, and I think sometimes, as much as you see death, it there will still be times that it can hit you just out of
Mhm.
nowhere. So I think taking time to decompress,
Mhm.
specifically if it's a very sick patient, the logical side of your brain is trying to process, was there
Yeah.
anything I could have done differently? Was there
Mhm.
something else that we didn't think of that could have gone wrong here? And so
Mhm.
you want to logically think about it, but then the emotional side of you is trying to process it as well. And one
Mhm.
thing that I think really helped me is my program director in residency. He told us,
Mhm.
sick people or well people, I should say, don't
Mhm.
come to the hospital. Everyone that comes
Yeah.
to the hospital is
Mhm.
is very sick typically, and there's a
Mhm.
spectrum of that. But
Yeah.
you have to understand death is part of life, and
Mhm.
if you can kind of understand that fact and appreciate it for what it is, then I
Mhm.
think it helps you maybe process things a little bit more. And one thing I would just share that I saw recently, and I'll read this if that's okay with you,
Yeah,
but
for sure.
uh, there is, I think, a card that's going around, like a badge buddy card that I saw recently on social media,
Uh-huh.
and I think I'm trying to find who to credit it to, and I'll have to maybe look this up after the fact.
Yeah.
But the card says this. It says, at the end of the code, when a patient's dying, this is something you can read aloud as the member of the team. And so the card says
Mhm.
this: could we take a moment just to pause and honor this person in the bed? This was someone who is alive and who's now passed away. They were someone who loved and was loved. They were someone's friend and family member. In our own way and in silence, let us stand and take a moment to honor both the person in the bed and all the valiant efforts that were made on their behalf. And I think,
Yeah.
you know, even just a small thing such as that
Mhm.
helps humanize this experience of death.
Mm.
When you see it so much, you can
Yeah.
easily compartmentalize it and just
Mhm.
desensitize yourself to it, which in a
Mhm.
way is good.
Mhm.
You can't take on the burden of everyone's grief, but in a way,
Right.
you do need the moments to really
Mhm.
reflect and humanize the experience.
Yeah. Yeah, that's so amazing. I love that because, sometimes we don't take that moment because we're just moving on to the next patient, the next thing that we have to do in the hospitals that um and that's why the desensitization dissociation seems more than the process of the emotion and the experience, just because things are so hurried. But I'm really amazed that they have created this thing to put on a badge buddy, as you said, so that people can remember to take that moment and like think of the patient that they took care of and honor the efforts that they did, try, knowing that we all are human and we all are not perfect and we're all, you know, sometimes unable to perform godlike things, right?
Yes,
And so,
absolutely.
yeah. Um, and so that's really powerful and so important to remember, especially in medicine. Um, so, how did you switch to business with medicine? I know that's a huge just departure from what we were talking about, but
Y-
just in that same fact, it seems like, a departure from medicine. But then again, is it really a departure from medicine? Is medicine changing so much that business is now kind of congruent with it?
Yeah, no, I think medicine, I think, is changing so much in this regard. And so,
Hmm.
as far as my interest in the business side of medicine,
Hmm.
it's complex, really. But the as I was in medical school, there was an opportunity that came up for me to do an MBA program while I was
Hmm.
doing my medical school
Hmm.
training. And so, I really kind of, without fully thinking it through, to be quite honest with you, I sort of
Hmm.
leapt at the opportunity, like, this sounds like something that could potentially be beneficial to me down the line. Because
Yeah.
this was at the point in time, even before I knew I wanted to do internal medicine specifically, before I knew I wanted to be a hospitalist. And I
Hmm.
just thought, well, you know, I love school in general, and I always
Mhm.
joke that if I could go back to law school and pharmacy school and just be a perpetual student, I would,
Yeah.
if it weren't for all the student loans that come along with that. So,
Yeah.
uh, so I thought, okay, this is a good opportunity. And as I,
Mhm.
got deeper into this MBA and then just to into business and medicine in general, it opens up really a whole new world. But I think the way that healthcare is shifting, I think it's provided me with a good background knowledge for the way that a lot of hospitals work, the way that insurance works, the
Mhm.
backside of things, and
Mhm.
it's really challenging because as a healthcare professional, and I'm sure you've probably experienced this too, there are many, many frustrating things from a business standpoint that
Mhm.
make it difficult to practice medicine.
Mhm.
And I think there are a lot of challenges we face as clinicians
Mhm.
that, when you look at things from a business perspective, it's
Mhm.
tough. But I think
Yeah.
blending the two things, and having specifically physicians in these leadership roles and these
Yeah.
administrative type roles, I think
Mhm.
makes way for potential change in a positive
Mhm.
direction for medicine. And that's
Yeah.
ultimately, my hope. And part of the thing that interested
Mhm.
me is I thought, well, down the road, I may not
Mhm.
want to be in clinical medicine forever. But
Mhm.
having that experience and taking that side of, the clinical side and the clinical
Mhm.
perspective into a more administrative role may
Yeah.
help make changes that really make
Mhm.
sense from that
Mhm.
perspective. So that
Yeah.
was really my main interest
Mhm.
as far as that's concerned, and we'll see where it takes me because
Mhm.
it's an ever evolving thing as I move through my career. Trying to
Yeah.
figure out what are the next best opportunities.
Mhm. For sure. Yeah, because I got to interview Denise. She's a nurse practitioner, but she became a CEO. So she's involved in like that business side, that administrative side now. But as a clinician, she always thinks of things as a clinician versus just a straight MBA,
Yes,
in that
yes.
practice, in that health model. And I think that helps a lot because I know for sure there are so many challenges. And of course, um, we struggle as clinicians um, to agree totally with the business side of things, although we know that it has to happen in that way, but for things to still function. But um, yeah, when you go into medicine, you want to just take care of people,
Yes.
and you're like, well, I don't care how much it costs, but then you have to be like, so how do you actually, create functioning clinics and hospitals that can actually, work for the best of so many people? But yeah, I think like that's so needed is more clinicians kind of getting into those positions so that they can advocate on behalf of the other clinicians and patients. So that, there is some not just looking at it um, from just a strict accounting
Yes,
point
yes.
of view sometimes, right? Because I know like, I mean, even in insurance wise, because you mentioned you got to look at it from that point of view too, which is kind of interesting seeing how, um, I had to talk to a patient who was saying, well, I lost insurance coverage for the rest of my stay and now I have to go home, but I don't know how I'm going to be able to actually be able to be at home because I still don't have the strength to stand up and take care of myself. And my wife is 80 and I don't think it's like all those different like aspects of, patient care. I feel sometimes we get lost in the business and the insurance. Medicine is so difficult now.
Oh, definitely. And I think as a whole, another kind of sad, very sad thing, which, we're just seeing on the news is
Mhm.
this killing of the United Healthcare CEO and
Oh, yes.
the public outrage that has resulted. On social media, I read that even, New York Times and other major publications are even having to disable comments on different stories because people are so up in arms and upset over people being denied care. And so it sparked this huge discussion. And
Mhm.
it's sad, and my heart goes out to really everyone that's involved in this horrible situation. But it
Yeah.
has sparked this larger discussion that it's like you
Mhm.
say, people who are being denied care, people who are
Mhm.
sick and they have no other option. And
Mhm.
that's the side of things where, as clinicians, I agree with you. What do? You do
Mhm.
everything you can do for someone, and what more can you do if the
Yeah.
resources run out, you know?
Yeah,
And
exactly.
that's very frustrating. So there's definitely room for change,
Yeah.
and I hope we can move toward change in a positive way.
Mhm. And, speaking of those changes and like, do you find that more physicians and providers are finding alternative ways to practice medicine due to these um, difficulties they face and the increasing access to, you know, online business models or other business models? But
Yeah, I do think
Mhm.
that is becoming more common practice, especially I've heard a lot of older physicians who are, further into their career, and they are completely fed up with the system that they're working in for whatever
Mhm.
reason, whether it be related to insurance or otherwise. And most
Mhm.
often, I think getting patients the care that they deserve.
Mhm.
And so I have seen a lot of people moving towards concierge style
Mhm.
medicine practices and fee
Mhm.
for service, and just
Mhm.
eliminating insurance altogether, moving towards
Yeah.
cash models. And so
Mhm.
I think definitely there's a shift.
Mhm.
The other thing too is the internet has really, it sounds just so simple to say in this way, but the internet has changed everything about medicine.
Yeah.
Um, I teach a healthcare
Mhm.
marketing course, and one of the things my students and I discuss in that is
Mhm.
the broad reach of the internet directly
Mhm.
connecting the consumer, in this case, the patient, to a
Mhm.
service that they need. The possibilities are endless. And so
Mhm.
there is opportunity out there
Yeah.
for clinicians and for patients to seek
Mhm.
care in a non-traditional way.
Mhm.
But there are still challenges with that too. So
Yeah.
I think there are changes on the horizon, but we'll see what direction the world moves, I guess.
Yeah. Yeah. For sure. I mean, there's a lot of barriers to care in every single model,
Yes,
depending on,
definitely.
what it's focused on. But um and as a physician, so what do you find is a challenge in like some of these leading medical systems and practices?
I think there are many challenges, and
Yeah.
sometimes I think the challenges are what lead to some burnout, even for
Mhm.
various reasons. But I think, yeah,
Mhm.
one of the major challenges is that there's always this push to kind of move people through the system,
Mhm.
whether or not it's you know we believe it to be warranted or not. You
Right.
know,
Yeah.
and that's not to say you'll always hear. Various administrators and other people, you'll see them, or you'll hear them rather, say,
Mhm.
well, ultimately the patient's health is our priority. And it is, and you hope
Mhm.
and pray that it is. But
Mhm.
there is that bottom line too. So you get,
Mhm.
as a physician or clinician, you do get pressure from the top that,
Mhm.
hey, so and so has been admitted to here to the hospital for X number of days, and
Mhm.
what is your plan to discharge them? And,
Yeah.
I personally have never felt pressured to discharge someone before they're ready, but
Mhm.
I know that I hear that does happen. And in those cases, there are delays for any number of reasons for delays
Mhm.
in care. And I think that's one of the trickiest parts of specifically being a hospital physician is kind
Mhm.
of the unspoken pressure. And sometimes, like I said, I've heard other people say the spoken pressure to move people through
Mhm.
the system,
Mhm.
and feel like you're doing the best you can in terms of caring for the patient. So I think that's
Yeah.
probably the biggest challenge for me.
Yeah. It definitely is a huge challenge, and um it's yeah, to be honest, like um you know, my my husband, you had to take care of him recently, and the whole cause leading to what happened was because he got pushed out of the hospital way sooner, without the actual, um, you know, exact discharge orders needed from the prior place that he had been at. And so it led to a series of unfortunate events that
Yes.
led to the, unfortunate outcome. And so, we can tell for sure that we are an example of that.
Yes.
And I even called them, and they even said that it was, their mistake of trying to get the, you know, patient out the quickest way possible without actually, following
Yeah.
exact orders. And so it's definitely a huge problem, and it definitely can lead to a lot of complications that are very unnecessary. And so, it's how do we change these things is one of the big things that are on the horizon, like how, and I know physicians and providers are, wanting to see those changes. Hopefully we can in the near future.
Yes.
Yeah. And so, but as a woman in medicine, have you faced any challenges or do you feel like that's something of the past?
No, I definitely have faced some challenges as a woman in medicine, and I find this to be such a tough topic, really, because, it's spoken about, I think, a lot actually now. And maybe it's because I'm hyper aware of the voices speaking out about women in medicine. And I specifically follow these type of people,
Mhm,
these women who are great leaders and great voices for our profession. So
mhm,
I have faced challenges. There's going to always be, or I think there's always going to be some level of sexism within the field, unfortunately. And, some of it I think is changing. So I have noticed a lot of positive changes. The numbers
mhm.
for women in medicine are quickly,
Oh, yeah.
um, outgrowing the
Mhm,
number of men in medicine even. But
mhm.
it's small things. It's things like, you walk into a room and you're wearing a white coat. You have a white coat which says doctor. You're wearing a badge which says physician or doctor on
Mhm.
it. You walk in and the patient and their family says, oh, hang on, the nurse is here. Or
Yeah,
just 1 second, and like, when am I going to
yeah.
see my doctor? After you've introduced
Mhm.
yourself as the doctor, 3 times,
Yeah,
4 times.
yeah.
And so those things, I'll be honest, they
Mhm,
they used to bother me quite a bit.
mhm.
And I took that a little bit to heart because I thought I've worked so hard, and
Yeah.
I really want to be recognized for the
Mhm,
education that I've taken the time to
mhm.
learn. But
Yeah.
now I take it a little bit in stride. I've
Mhm,
noticed that I do think things are gradually getting better. I do
mhm.
notice within, I work in a lot of different healthcare systems as a locum, and I can tell some systems lag behind other systems. But I think as a whole, I feel respected in the
Mhm.
profession. I think there are still people who, at the end of the day, they only believe that a doctor is a man. And I don't think you can change people's minds if that's the way they think.
Yeah.
But as a whole, I think the respect for women in the field is growing, and I think it's been a slow and steady change that I
Mhm,
have seen over the past couple of years.
mhm. Yeah, for sure. I mean, the number of women in medicine is so gets getting higher and higher every year, it seems like. And
Yes.
so, which is a great thing, considering it wasn't so long ago that things were so very different. Um, so what are some things that you found that leads to provider burnout? Um, you've talked about some things, but not specifically.
Yeah, that's a great question. And I
Mhm,
think this is a question that could be different for every single person. For
mhm,
me specifically, I have one specific moment in time that I can remember feeling like completely burned out. Like I felt like I can't do this career anymore. I can't do this anymore. And that was
mhm,
during my residency training during the height of the COVID pandemic
Mhm.
for me. And during this specific time, I was taking care of an ICU patient who was critically ill. They were intubated on the ventilator. For those familiar with,
Mhm.
medicine, which
Mhm.
they were paralyzed, they were heavily sedated, they were on the very maximum ventilator settings. Um, and at this time, visitors were essentially not
Yeah.
allowed. And staffing was, places were understaffed, resources were
Yeah.
low. And I just remember I was in the corner of this room in the ICU. It was like the corner of the hallway,
Mhm.
and it was far away from the nurse station. And I was in the patient's room by myself in full PPE, doing a procedure on this patient. And I was just standing at the head of the bed, and I just felt helpless. And
Mhm.
I could feel, I was crying.
Yeah.
It makes me almost cry to talk
Mhm.
about it now because it feels
Mhm.
just fresh,
Yeah.
that moment. It's like I can relive that moment. And I just
Mhm.
felt completely helpless. I felt
Yeah.
like, what I'm doing is not enough. I felt like, what we're doing, it, it felt like the death was overwhelming at that time. And this we talked about earlier with processing the death of so many people, but it was overwhelming, and I felt very alone. And I felt this sense that the only thing that mattered was what I was doing at work, and what
Mhm.
I was doing at work, it felt like that also didn't matter. No matter what
Yeah.
my efforts were, I felt like they
Mhm.
weren't enough. And
Mhm.
so in that moment specifically, I had a deep sense of burnout. And I think
Mhm.
it was this, essentially this trauma of taking care of critically ill patients for such a long period of time in such high volumes. And
Mhm.
I think a lot of clinicians can relate to this, specifically with COVID. I think it really changed so many people. And I know for a fact it definitely changed me. And,
Mhm.
thankfully, I came out of that,
Mhm.
and, felt a renewed passion for medicine. But it
Mhm.
took me a really long time to
Mhm.
really kind of move past this feeling that I wanted to run completely away from medicine.
Mhm.
And that's just one factor of burnout. I mean, there are so many others with, insurance denials and feeling like the system is broken, uh, feeling like the hours are tough. You may not see your family often, especially
Mhm.
during training. So
Yeah.
I think for everyone, it could be different. But for me, that was the moment that I just felt, I lost my spirit for this.
Mhm. Yeah. Did you ever find any other communities or people that had gone through the same thing, or find any resources to help providers who had faced those similar things, especially after COVID?
Yes, I did. Fortunately, this was during residency for me. And so,
Mhm.
fortunately, we did have a counselor in our
Mhm.
residency program
Mhm.
specifically dedicated to seeing us as residents. And it was a
Okay.
mandatory thing so that even if
Yeah.
you didn't feel that you needed help, that
Mhm.
there was still somebody who was going to listen to you. And I think that really helped me process a lot of this. I
Mhm.
didn't really seek communities outside of that specifically, but that
Mhm.
is when I started turning towards other hobbies outside of medicine,
Mhm.
because I had a particularly low point where I just remember I was in my apartment at the time and I was crying, and I just thought, how can I pull myself kind of out of this? Because I
Mhm.
felt, like I said, that I wanted to quit, and I wanted
Right.
to quit residency. And I ended up I went to YouTube. I was watching a lot of music and listening to a lot of things, trying to listen to different
Mhm.
inspirational videos. And I
Yeah.
stumbled across this. I literally Googled like some inspirational playlist.
Yeah.
And I heard this video, and
Mhm.
this one phrase stood out to me, and I've not forgotten it since then. And it was, a religious video, and
Mhm.
the person speaking said, God's not finished with you yet. He has a plan for your life.
Mhm.
And so, what basically, whatever it is that you're going
Mhm.
through, whatever low point you are experiencing, you have
Mhm.
to keep going.
Yeah.
Um, And so I took that and I ran with it.
Yeah.
And it wasn't a straightforward journey to love medicine again, but it
Mhm.
kind of renewed this sense of, I do have a purpose. I do have a
Mhm.
reason for being here in medicine. And, I'm going to find things outside of medicine that will ground me and bring me back to myself again, other
Mhm.
hobbies, other things. And gradually through that, just working through those, hard times, then
Mhm.
I really did renew my passion for this.
Mhm.
And there are still tough days, but I
Mhm.
feel, happier than ever in my career.
Mhm. Yeah. I think what's interesting is I feel like a lot of providers have really kind of expanded their hobby list since that time. And I feel like so many people have latched onto so many creative ideas too, that have not just been outlets, but maybe even ways that they can um, create other avenues of work, even just based off of their hobbies and based off of things that they have passion to do outside of medicine. And I think that's so important as well, like just having those things. Because, you know, just work alone will, you can't live by work alone.
Yes, that is true. And
Yeah.
that's where I think the, nature of medicine sometimes can be
Yeah.
toxic is because
Hmm.
we are convinced for so long, just by nature of the field that, hey,
Hmm.
this is the most important thing and
Hmm.
you have to give it your all, you have to grind. We're all, for the most
Yeah.
part, type A personalities.
Hmm.
And as a result of that, you sort of get this perfectionist mindset, and it's
Hmm.
really difficult to break away from that. And only when I broke away from that is when I started really feeling like a renewed sense of energy about the field. So I
Yeah.
think I agree with you. I mean, I think that's probably what happened to a lot of people around this
Hmm.
time.
Hmm. Yeah. And so I know that you had realized you were burned out and then you did a lot of different things, but how did you get into teaching? Or was that one of the things that it got you out of burnout?
Yeah, teaching definitely, it did help bring me out of some burnout too. The timing of
Mhm.
it is that when I was feeling burned out, I was considering what are other things I can do related to my field,
Mhm.
and my specialty that would allow me to still, uh, use my skills, but do something outside of just this clinical work.
Right.
And so I started looking into teaching opportunities, and I stumbled upon this opportunity at a local college to teach first anatomy, and then I broke into some of their business courses and healthcare
Oh,
marketing and things like
yeah.
that. And so
Mhm.
I teach those online. And, ultimately, I love teaching. I would love to
Mhm.
do even more of it. So it's fairly new for me at this point, but it's one of
Mhm.
those things where I felt like, I'm still at the core, as much as
Yeah.
I try not to be, I'm still a little bit type A. And
Uh-huh.
so when I'm not working, in a clinical setting, my brain is always thinking, like, what can you be doing? And teaching is one of the things that has actually helped me,
Uh-huh.
to just have something else to focus on when I'm not in the clinical setting.
Mhm.
So, uh, so it's been great. It's
Yeah.
been really great.
Yeah. It's kind of funny because I feel like a lot of people in medicine, they have to keep doing something. Even if they're not working, we have to be doing something else. So,
Exactly, exactly.
yeah.
Because as hospitalists, we don't traditionally work a normal schedule. So a lot of
Right.
hospitalists work
Yeah.
like 7 days on, 7 days off.
Hmm.
And I was
Yeah.
finding during my off week, I was just getting so bored.
Yeah.
And so, I have plenty of other things I can do, but my mind just wanted to do something else.
Yeah.
Um, and this
Yeah.
definitely, it's an avenue for that. So
Yeah. And locums. So you also spend some time doing locums as well. So how did you get into that?
yeah, so actually locums, it's interesting. And I don't think even that I mentioned this to you, but
Mhm.
locums is what I do full time. So ever since
Oh, okay.
residency, I have worked really in hospitals all across the country. And
Oh,
the way that I got started with that is my
mhm.
husband is 2 years ahead of me in training. And
Okay.
so he had taken a full-time job
Mhm.
where for about a year while I was still finishing up training. And then
Uh-huh.
he said, I think I'm going to do locums. And I didn't know much about it at the time, but,
Mhm.
like I mentioned, we both have this passion for traveling. And this is
Right.
before we got married when we started doing locums.
Uh-huh.
And so he mentioned it, and I had heard other people talk about it. And
Mhm.
you're acting essentially as a contractor. And so you have a wide range of flexibility in where you
Mhm.
go, what kind of jobs you take, how
Mhm.
long of a stretch you want to work,
Mhm.
and so you have a lot of control over your schedule.
Yeah.
Um, and that was one thing that really appealed to
Mhm.
both of us because, with the traditional 7 on, 7 off schedule,
Mhm.
you don't have as much flexibility for things like international travel. And,
Mhm.
if your
Mhm.
7 days on happens to fall over a holiday, it's
Yeah.
not like a normal job, so to speak, where you
Yeah.
can just take time off. That
Mhm.
you can't really. So,
Yeah.
and there are exceptions to that, of course, but
Right.
it just was very appealing that, hey, this is a way to see how so many other systems work,
Mhm.
experience a lot of different healthcare settings in different places, different
Mhm.
populations, um, different areas of the country have different, uh,
Yeah.
specific health problems more so than others. And so we just thought this would be a good way to see and do it all, so to speak. So we've been doing that now for about 2.5 years.
Okay. And did you mention that you did locums internationally too? I think in a conversation before.
So
Or was it just
yeah, we have not done locums internationally, but there
okay,
are international opportunities. So I
okay,
I did some international rotations during medical school,
okay.
and during that time, I thought it's so interesting to see how medicine works in other countries. I was
Yeah,
specifically on a rotation in Australia,
that's right. Yeah.
and that I had this
Mhm.
conversation. I think because Paul is from
Yeah.
Australia, is that right?
Yeah. Yeah, he grew up there.
So so the culture there is totally different and the healthcare
Mhm.
system is totally different.
Mhm.
But there are opportunities for international locums. The licensing just gets to be a bit tricky depending on
Yeah.
where you're looking into.
Mhm.
So I do
Mhm.
see a lot of jobs advertised in New Zealand.
Oh,
Um,
yeah.
for whatever reason, I see that come across a lot. Um,
Yeah.
but it just hasn't really specifically fit into what we're looking for at the moment because I think most
Mhm.
of those international opportunities they want it's essentially a full-time contract,
Right.
um, but it's a locum contract, but they want you there
Yeah.
for like a year, and
Uh-huh.
so that at least as of right now it doesn't
Mhm.
exactly fit into our schedule that we're planning, but
Right.
maybe
Right.
one day because it
Yeah.
certainly would be, I think, super cool to see how things work in different places.
Yeah, for sure. I think that's really cool how, and I think a lot of people are getting into this locums. I know there's like this PA who's become an advocate for PAs being doing locums and helping people get into that type of work environment because you're right, it affords the flexibility. This, you can schedule whenever you kind of want to go and do so. It's kind of really nice. And so do you find it challenging though, like going, because locums is a temporary assignment. So do you find it different than it as if you were kind of more of a full time, like in that place for a longer period of time? Or
Yes.
does it really matter?
Yeah, it's definitely different. And,
Mhm.
I think there are a lot of challenges with locums. And I will say, it's really
Mhm.
not for everyone. I have many friends I talk to, and I know based on kind of our conversations, it would not be a good fit because the
Mhm.
reason is this. you have to be really ultimately very, very flexible.
Mm-hmm.
You are moving into a new system. You could be
Mm-hmm.
there for 6 months. You could be there off and on for a year. Some places I've
Mm-hmm.
been going to off and on for 2.5 years. And
Mm-hmm.
every place you go is a new system to learn. There's a
Mm-hmm.
new schedule. There's
Mm-hmm.
new, just the logistics of parking and the
Yeah.
door code to get into the workroom and
Right.
the
Right.
different
Yeah.
EMR systems and
Mm-hmm.
learning people's names, learning the case managers, learning the
Mm-hmm.
nurses. So
Yeah.
it's tough to juggle all that sometimes. And the other
Mm-hmm.
thing I will say is this: you really have to establish a new sense of trust with every place that you go into. Because
Yeah.
if you work in a place long term, you get to know the nurses, you get to know
Mm-hmm.
the other physicians and
Yeah.
clinicians, and they know who you are and they know,
Mm-hmm.
that they can trust you.
Mm-hmm.
But working in a brand new place, you really have to
Mm-hmm.
establish that sense of trust, and that
Yeah.
can take time to establish those connections
Mm-hmm.
and relationships. So you really have to be comfortable with asking questions, and you're
Mm-hmm.
essentially like putting yourself in an intern sort of position every place you go. And that can be
Yeah.
humbling too. It's like, okay,
Yeah.
I don't know how to find the on-call list, nobody told me this. So it's just like these
Yeah.
small things that definitely make it challenging, but you do get used
Yeah.
to it. I'm used to
Mm-hmm.
asking questions. So
Mm-hmm. Yeah. I think that could make you a better provider in a way because you're just constantly, um, or maybe I don't know. It's just you. You're just so full of compassion and care, and you do such a thorough job. But
that's so
and
so kind of you to say. Thank you.
maybe it's your locums experience. But yeah, so it's interesting though because every time you go to a different hospital or facility or clinic, then even the nurses say, "Well, I still don't know that doctor's style." And
Yes,
so to have to constantly be moving and have, you know, everything always new, that's definitely one of the challenges of going into locums, right?
definitely,
Yeah.
definitely.
So how would you encourage other providers in their practice and life?
I think that's a really great question, and there's so many things I think that I could say, but I think the biggest thing is, number one, to remember who you are and why you started medicine in the first place. And I think
Mhm.
doing that is a key to preventing that sort of burnout, is just remembering at the core of why you started this, because it's easy to lose sight of that when you get bogged down with all the small tasks and the small issues and the big
Mhm.
issues too. It's
Yeah.
the stress can be a lot. So I think kind of remembering and renewing that sense of passion. And for me,
Mhm.
that actually was, outside of medicine. Who am I outside of this, and what do I bring
Mhm.
to this? So I think
Yeah.
that's one key piece of advice that I would have for people. I think
Mhm.
the other thing too is just to really try to remember that the most important thing when you show up to your job is the patient at the end of the day. And I think
Mhm.
it's very easy to get sucked into the culture of, I have to see the patients, I have to round, I have to do my notes, I have to do 20,000 forms and papers and things. And if you take the time, I think, to sit down in the room with the patient, I
Mhm.
think that means more to patients than almost anything else you can do as a clinician. Um,
Yeah.
you know, Remembering that this is not just an encounter to get to the next encounter. It is an
Mhm.
encounter with a human who needs you.
Yeah.
And they have a life, they have a family, they have jobs, they have things outside of
Mhm.
what you see them as
Mhm.
in this acute illness setting. And
Mhm.
so remembering that, and just a
Yeah.
small conversation,
Mhm.
it just goes such a long way. And I think that's
Yeah.
probably one of the things too. I can credit my program director in residency, Dr.
Mhm.
Weigel. He was really good about, you really need to sit down and give someone your attention. Give them your
Mhm.
time. and
Yeah.
everything else will work out. It will work itself out. You can make up the time in other places.
Yeah.
But giving the patient your time, I think that's one
Mhm.
of the key pieces of the advice I would give to a new clinician, or any clinician really.
Mhm. That's so key. And I think it goes back to even that first topic we were talking about is taking those times in medicine to experience the humanity of the patient,
Yes.
instead of just desensitizing ourselves so much so that we're just robots doing the job. And so that's so key is, yeah, bringing that humanity into and empathy back into the practice.
Yes. And it's tough to do sometimes, but I think
Mhm.
it's what separates, I think, a good clinician from a great clinician. And I think you'll
Mhm.
you'll find, patients feel that.
Yeah, yeah, for sure. They definitely see the differences. Um, so, what else would you advise for those who want to avoid burnout?
I think it's a lot of community support is really big, in addition to some of the other things that we've talked about, in addition to, hobbies and
Mhm.
grounding yourself with other things. I think kind of reaching out to other people going through the same thing, like you alluded to this earlier, communities with providing support, people that have also been through
Mhm.
similar things. But I
Mhm.
don't think it even has to be people that have been through this exact thing. I think
Mhm.
making sure that you surround yourself with people that you
Mhm.
can talk to about work and not about
Mhm.
work, and about basically everything, whether that's your partner or a
Mhm.
friend group, or,
Mhm.
a community group. I think just kind of not keeping it totally to yourself, just letting
Mhm.
someone know that, hey, this is kind of, I'm feeling frustrated about
Mhm.
XYZ.
Mhm.
Just even unloading that can be helpful to get someone else's perspective, to get someone else's support.
Mhm.
I had many, many people who, supported me on a personal
Mhm.
level when I was experiencing burnout, and that
Yeah.
made all the difference to me.
Yeah. Yeah. And I love how you also had mentioned that you were reminded that, ultimately God's not done with you yet. And there's always a purpose and a plan to be fulfilled. Um, and so, what advice would you give to women in medicine?
I think the, biggest piece of advice is just to be confident in who you are. I think it can be easy to be convinced that this field is not for you. I think small, I think the term is, microaggressions. I don't really like that. I don't like that term that much,
Yeah.
but I think that's the term that people use. And I think you can be sort of backed into a place where you feel like you might not belong here, you might not
Mhm.
be cut out for this. It might be impossible for you to achieve what people perceive as, your duty as a woman to society if you
Mhm.
have a career in medicine. But
Mhm.
ultimately, that's simply not true. There's so many ways to balance medicine
Mhm.
and being a woman, and
Mhm.
I think there's a place in this for everyone. So I think just
Right.
being confident in that,
Mhm.
and knowing that there are so many strong women out there who are
Mhm.
advocating for women in medicine, and
Mhm.
also becoming a part of that voice too.
Yeah.
The more
Yeah.
comfortable you are in yourself, I
Mhm.
think the easier it is for people to respect you in that position.
Yeah. That's awesome. Well, thank you so much, Sarah. I'm so glad that you decided to come on the podcast out of our just extraordinary meeting, chance
Yes.
meeting. So I appreciate it and I loved the conversation. And I know that people will find hope, that they can spark hope in their families, in their communities, and know that they can be the change they want to see in this world. And they can be the hope that they want to empathize with others And I am so glad that you guys joined us today. And I hope you enjoyed this podcast episode. I look forward to seeing you again next time. Thank you so much.
Thank you.
Thank you for joining us on this episode of Medicine, Motherhood, Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. The medical opinions expressed on this podcast are for the informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical questions or concerns. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.